Lisa Bonsall, Senior Clinical Editor for Lippincott Nursing Center. I'm here at the Nursing Education Innovation Summit. Right now, I have the privilege to speak with Susan Forneris and Michelle Moulton about their presentation, From Bedside to Brain, Simulation and Brain-Based Teaching. What is situated cognition and how does it intersect with virtual simulation?
Situated cognition is, it can sound like a really complex term, but if you break it up and you think about cognition on one side and situation on the other, it is providing the opportunity for a learner to think, use their thinking or their cognition in a real life context. So situating that so that they have the opportunity to think through with the dynamics of the environment weighing in on how they think through the situation. Another example might be back Dr. Patricia Benner, when she wrote a lot about novice to expert, she would talk about the novice nurse or the new nurse coming into practice as being acontextual, meaning they come without context. They're not like a seasoned nurse who has lots of stories and situations that they file away, that as they encounter new patients, they can easily draw from that experience, from context, to help inform their decision making. So nursing education needs to, in the classroom environment, provide learners the opportunity to use the context within, or use the content, within the context of patient care. VSIM is a story. It's a story of a patient that unfolds over time and will respond in that time frame based on what the nurse does or decisions the nurse makes or the actions the nurse takes. So the learner in VSIM has the opportunity to all of a sudden begin to apply and use their content knowledge, their thinking, their cognition in a situated learning environment. So they can, and VSIM provides that environment, that real life patient encounter.
I would also just add that there's in an example, you can look at a piece of clinical data like a blood pressure, and you can even put parameters around it. You have elevated blood pressure and low blood pressure. That is acontextual information though, even if it's elevated. The context that can be added with virtual simulation is that now you've got this abnormal blood pressure, but now it has meaning, right? It's tied to a patient, their age, their medical history, and then you've got some time pressure, right? Because that's not your only patient that you're responding to that blood pressure. You have other priorities to think about and to weigh in context when considering this piece of clinical data.
And that one blood pressure might be within the norm for that patient as you trend. So what might look like a high blood pressure on paper, acontextually, may not be as scary or as needing attention in the same way that if you compared it and they had a lower blood pressure over time.
What are the connections between situational awareness and clinical reasoning?
So clinical reasoning, especially if we look at the clinical judgment measurement model from the NCSBN, Next Gen NCLEX, layer 3 really does a nice job of taking clinical reasoning and breaking it down into its pieces. So recognizing cues, analyzing, prioritizing, generating a hypothesis, and coming to an action. When we think about, so that's all cognitive processing that we all do as nurses under the hood, right? Nobody can see that. What's interesting about situational awareness is that the definition of situational awareness is perception, comprehension, and anticipation or response. So what that looks like, if you look at those two definitions together, that really mirrors very closely what clinical reasoning is. It's getting data, assigning meaning to data, and then responding or anticipating a next response. The work in situational awareness that's been done in many other industries, such as aviation, military, law enforcement, can help us to take what the work that they've done around situational awareness to help people respond to certain situations and how to broaden their awareness to get more information to help them make decisions. We can take the work that many other industries have done around developing situational awareness and pull that into nursing education, and to help our learners develop that cognitive practice of clinical reasoning, of gathering information, assigning meaning to it, and deciding what to do next. So I think when we think of like an example in a pilot's training, they may do a simulation of a flight simulation, and they have to think about what data is coming in, assign meaning to it, and then respond in the simulator. And we can do that here in developing nursing practice, in the classroom, in the simulation lab, in clinical.
I would add that the notion of being situationally aware, sometimes if we think about that and we are working with our learners to think about their surroundings, it also creates an opportunity for them to ask questions, to double check the information with somebody else, to sort of get out of that snap decision of being very reactionary and taking action right away. It's to step back a bit and run their awareness by somebody else. What am I missing? Is there something else I should be paying attention to, which is something we tend to gravitate to when we're in practice. We check things with our colleagues on the unit or in the field. And if we can provide opportunities around making our learners more cognizant of their situational awareness, that fear of, oh, should I ask, goes away. It's just, I'm cementing that I am paying attention to everything I should be paying attention to here.
We can help our learners ask themselves, am I getting all the information?
Right.
Am I seeing the whole picture? What am I missing? And if we can help our learners develop that inner monologue while they're in practice, then they will be able to then pull in that colleague and say, help me see this. Something's happening, something is not right, but I really need help getting down to like what's really going on. And, what we know from situational awareness is that we as humans are not good at keeping ourselves situationally aware. We need somebody else to tap us on the shoulder and say, did you see that blood pressure? Did you see the monitor going off? And because you might respond and say, no, I was looking at the glucose. I was really concerned about a completely different part of the patient care scenario, which could be valid. But sometimes we get tunnel vision and we can lose sight of the bigger picture. So we need to pull in and have that kind of meta awareness of our awareness, that we need to pull people in to help us in our decision making and in our clinical reasoning. And if we can do that in the classroom with learners using virtual simulation, or even in the simulation lab, with coaching, with feedback, with expertise that a teacher can provide, learners can do that, gain that skill a lot faster, and not just faster, but for better practice.
And how can virtual simulation prepare learners for Next Gen NCLEX?
I think the other piece of the use of a vSim is that it does provide context, but it also provides an opportunity for the learner to keep rehearsing. And one of the, as you think of the micro skills of clinical reasoning that make up, your ability to make a judgment, a clinical judgment, rehearsing that pattern is something that we often in education fail to do. We think that if they do this experience once, they've learned it. When this micro skill, array of little tiny skills put together to lead to clinical judgment is not something that you can do just once. You have to practice that. And vSim allows that opportunity to go back in and redo it, slow it down, have a conversation about it. You can stop things in real time, and an educator can ask a learner, walk me through your thinking. What are you thinking in this point? And those opportunities to dialogue with our learners, to pull back what's going inside their head and double checking their rationale is so important.
I think sometimes in nursing education, what I know I myself have gotten into the habit of doing is providing a list of, talking about a respiratory condition, say COPD, and then running through all the signs or symptoms and the assessment data, and here are the complications, and here are all the things that can happen. And we give it in list form, right? Bullets, right, on a PowerPoint slide. And then on the exam, what we want to evaluate and measure, because this is what's happening in practice, is we give a situation and we give a story, a little vignette, a patient with the history and data, and we ask the learner to respond to that now. So now they're responding to this data in context, and we're evaluating that, but we're not teaching that. So we need to teach, our teaching methods need to match how we're evaluating. So if we're evaluating at a high level where there's analysis and decision-making happening, then we need to teach with analysis and decision-making happening in the classroom. And so things like virtual simulation and other modalities can help create that practice and that rehearsal.
Yeah, they're tools that we can put in our toolkit to use.
Thank you so much.